Today, we're diving into the powerful role of artificial intelligence, or AI, in transforming the landscape of healthcare, particularly in the domain of sexually transmitted infections, non-venereal genital diseases, and overall sexual health and wellness. AI's capabilities are expanding rapidly, offering promising new tools for screening and diagnosing STIs through advanced image recognition and comprehensive analysis of patient data. This technological advancement isn't just about improving diagnostic accuracy. It's also about creating a more inclusive healthcare environment. AI is not only enhancing the precision of diagnoses, but also revolutionizing e-health and direct-to-consumer services. These technologies enable more targeted screening and highly personalized health interventions, all while making health services more user-friendly. Furthermore, artificial intelligence plays a critical role in education through interactive, empathetic chatbots that offer new ways to learn about sexual health, making information more accessible and understandable. But it's not just about individual health. On a larger scale, AI's integration into healthcare systems serves as a decision support tool that can significantly enhance the accuracy of diagnoses in real time. Using big data, artificial intelligence also boosts the capabilities of real-time epidemiology, predictive analysis, and targeted interventions, potentially reshaping public health strategies. However, as we advance, we must also navigate significant challenges, ensuring the accuracy of artificial intelligence in real-world applications, addressing liability issues, protecting privacy, and overcoming ethical dilemmas. Looking ahead, our focus must be on inclusivity and effective communication across languages to ensure that these innovations benefit everyone. This journey will require close collaboration among policymakers, researchers, and healthcare providers to fully harness AI's potential to transform sexual health services. Welcome. There's been a significant buzz around the potential of artificial intelligence, especially within healthcare. This surge in interest has been marked by a growing number of publications, opinion pieces, and lively discussions, underscoring the critical role artificial intelligence play. Particularly, the fields of genital dermatoses and sexual health provide compelling scenarios for deploying AI technologies. Today, we're going to explore how artificial intelligence is being used to tackle sexually transmitted infections, non-venereal genital diseases, and issues surrounding sexual health and wellness. We'll delve into the distinct advantages these technologies bring to the table, as well as the challenges they face in transforming contemporary healthcare practices.
Welcome to Health Explorer. Here, we delve into a wide range of health-related topics, from understanding various diseases to discovering effective natural remedies whenever possible. Our mission is to provide you with reliable, accurate information sourced from reputable websites and the latest scientific research. We explore the effectiveness of modern treatments and discuss their real-world applications and potential complications. By joining us, you'll gain valuable insights into health, wellness, and disease management. Don't forget to like our videos, subscribe to our channel, and hit the bell icon to stay updated with our latest content. Let's embark on this journey towards better health and knowledge together.
Present status of STIs and non-venereal genital dermatoses. Let's take a moment to understand the current landscape of sexually transmitted infections and non-venereal genital dermatoses. Globally, STIs are on the rise, affecting millions. Around 500 million people live with genital herpes, and 300 million each are battling human papillomavirus and chronic hepatitis B. Not to mention, 37.7 million are living with HIV. Each year, we see about 374 million new cases from curable STIs like syphilis, gonorrhea, chlamydia, and trichomoniasis. That's over 1 million new cases every single day. Even though we've seen a decrease in HIV infections in some places, like India, since 2000, the numbers are still staggering, with 2.4 million affected in 2021 alone. From 1990 to 2019, the rate of STIs, excluding HIV, has jumped by 58.15%, outpacing population growth. And more recently, we've witnessed a troubling resurgence in diseases like syphilis and chlamydia. Interestingly, while regions like Africa and the Western Pacific are heavily burdened with diseases like HIV and hepatitis B, it's actually the Americas that are seeing the fastest increase in diseases like chlamydia and syphilis. When it comes to non-STIs genital conditions, the data might be less comprehensive, but the impact is significant. These conditions can cause considerable anxiety and affect the quality of life, often leading to sexual dysfunction, especially in diseases like genital lichen sclerosis. It's clear that whether we're talking about sexually transmitted infections or non-venereal conditions, the impact on individuals' lives is profound and widespread. Current challenges. Let's talk about why we're seeing this global surge in STIs. On one hand, better healthcare access and improved testing have led to increased reporting, but the numbers might still be underreported. Here's an interesting paradox. While overall sexual activity in the US has been declining, riskier behaviors are on the rise. Things like reduced condom use, more oral and anal sex, and drug use are increasing, especially among certain groups like those using HIV prevention medication and men who have sex with men, MSM. Part of this shift comes from the perception that HIV/AIDS is no longer a fatal disease, but a chronic, manageable condition. The digital age has also reshaped how people connect, with social media, chat rooms, and dating apps playing a big role in changing sexual behaviors. The COVID-19 pandemic and monkeypox outbreaks caused further disruptions, delaying testing and straining resources that were already underfunded. This led to a rebound in cases once things started to open back up. In resource-limited settings, traditional challenges like lack of awareness, stigma, delayed diagnoses, and poor healthcare access continue to be significant obstacles. Young people, in particular, face unique issues like confidentiality concerns, leading many to avoid seeking sexual health services altogether. Even when they do, limited specialists and underfunded programs mean that primary healthcare providers often have to fill the gaps, but they're usually overwhelmed, undertrained, and hesitant to discuss STIs openly. Despite living in an information age, accurate knowledge about sexual health is still hard to come by. Social media spreads misinformation, and many mainstream platforms either lack reliable content or censor important discussions about sexual health. There's also a stigma that makes it difficult to talk about these issues openly, especially for at-risk groups like LGBTQ+ communities. This is where artificial intelligence comes in. Dermatology, which heavily relies on visual analysis, is especially suited for AI-driven diagnosis. When it comes to sexually transmitted infections and genital diseases, which carry a lot of stigma, artificial intelligence can offer discreet, anonymous consultations and reliable advice, helping people access care without fear of judgment. Artificial intelligence and machine learning. When we talk about artificial intelligence in healthcare, it's important to clarify what it really is and what it's not. A lot of people confuse AI with simple internet-based health services or automated programs, but these aren't true AI. Traditional algorithms follow, if this, then that rules, responding predictably to inputs. Artificial intelligence, on the other hand, mimics human intelligence and learns from data, adapting its approach as it goes. A key subset of AI is machine learning (ML), which involves feeding data to the system and letting it improve on its own. Deep learning, a more advanced type of ML, uses artificial neural networks inspired by the human brain. This allows it to recognize complex patterns in data, like in image analysis for medical diagnoses. For example, in dermatology, artificial intelligence doesn't need to be told exactly what to look for. It can pick up subtle details and patterns in images that even human experts might miss. However, artificial intelligence is only as good as the data it's trained on. If the data is biased or low quality, the AI's output will reflect that, leading to what's called the garbage in, garbage out effect. This is a big issue when it comes to diagnosing genital conditions, where training datasets often lack diversity, particularly in terms of skin color or images of genital areas. As a result, current AI tools may struggle with accuracy in these cases, and women's sexual health, in particular, is often underrepresented in its development. While AI-powered tools are becoming more common, many products marketed as AI still rely on basic algorithms. For true artificial intelligence, especially those capable of natural language processing, like the chatbots you interact with online, much more complexity is involved. These systems are far beyond the rule-based chatbots we're used to seeing in customer service, offering a glimpse into the potential for more interactive and empathetic digital health support. Uses of AI in STIs, non-venereal genital diseases, sexual health, and wellness. artificial intelligence is making impressive strides in diagnosing STIs and genital diseases. In dermatology, AI models have been trained to recognize diseases with remarkable accuracy, sometimes even outperforming primary healthcare providers' PHPs and matching dermatologists. For instance, the AIinHealth app, which analyzed 5,000 images of penile sexually transmitted infections, achieved accuracy rates of 86% for syphilis, 93% for genital herpes, and 96% for genital warts. Another app, Dermoid, which is trained on 40 skin conditions, including genital diseases, outperformed PHPs with high accuracy for diagnosing conditions like anogenital warts and genital lichen sclerosis. These platforms are especially promising because they're designed with diversity in mind, using datasets that include a significant number of skin of color patients. They're also being trained to recognize conditions in underserved groups, like transgender individuals and women, who have often been overlooked in medical AI development. By integrating data from sexual behavior history and patient-reported symptoms, these AI tools are becoming smarter at making accurate diagnoses, assessing risk, and recommending targeted screening options. Linkage to e-health, social media, and direct-to-consumer services. E-health and direct-to-consumer D2C models are already changing the game for STIs and sexual health services, and artificial intelligence is speeding up this shift. For example, AI could be used to show targeted ads for discrete sexually transmitted infection kits or sexual education resources at key moments, like when someone matches on a dating app. We're already seeing successful integrations, like linking STI testing services with dating platforms for specific communities, which shows this approach is not just possible but effective. Right now, rolling out these kinds of services takes a lot of manual effort and tweaking. But with artificial intelligence, platforms can automatically learn from user behavior like match frequency and location and continuously improve, making interventions more personalized and timely. AI can also cut through some of the current barriers in e-health services, like confusing search results or overly technical language, by quickly understanding what people actually want and delivering clear, relevant information. D2C screening, like at-home STI tests, offers huge benefits, reducing the stigma, embarrassment, and inconvenience that keep people from getting tested. While there's some concern about false positives, artificial intelligence can help refine these services and better target who needs what. Plus, linking these platforms with social media and digital marketing can help spread awareness and encourage more people to take control of their sexual health. Sexual education and counseling, chatbots. AI-driven platforms and chatbots are already providing personalized advice for general health, nutrition, and fitness, so it makes sense to extend this rigor to sexual health and wellness. Teens and young adults, who face significant barriers in accessing traditional STI services, are typically the quickest to adopt new technology. AI-powered chatbots can offer discreet, interactive, and empathetic sexual health education, often being more engaging and understanding than basic online resources or even some doctors. These chatbots have already shown success in educating people about HIV and have been effectively integrated into social media platforms. Integration of AI into the healthcare system. Quick diagnosis and treatment are crucial when it comes to sexually transmitted infections, but long wait times to see specialists can be a major roadblock. Primary healthcare providers usually handle these cases first, often using a syndromic approach. But this method can miss non-STI genital conditions, which are frequently mistaken for STIs. Artificial intelligence can step in as a valuable decision support tool for PHPs, offering real-time assistance and helping them improve diagnostic accuracy. While AI tools won't replace dermatologists, they can complement their work by suggesting treatments or guiding PHPs on when to refer patients for more specialized care. Big data collection, epidemiology, and statistical analysis. AI-powered mobile apps can be game changers when it comes to tracking and managing STIs on a large scale. By integrating with public health systems or private clinics, these apps can analyze real-time data and spot outbreaks faster than current reporting systems. They can also help target interventions more effectively. During the COVID-19 pandemic, artificial intelligence models were even used to predict the real incidence of sexually transmitted infections when traditional reporting systems were overwhelmed. Data from chatbots and social media can also be analyzed to understand what young people are most concerned about, which in turn can shape education and counseling programs. AI algorithms can sift through social media data to predict trends and risky behaviors, and they've already been successfully used to forecast spikes in HIV and syphilis cases. Limitations and drawbacks of AI. Despite its potential, AI still faces some significant challenges. For example, AI models that work well in controlled settings might not perform as accurately in real-world situations, especially when dealing with user-submitted images that are often poorly lit or partially covered. Another big concern is who's responsible if the AI makes a wrong diagnosis: the software developer, the clinician, or the company behind it. Privacy is another major issue. Although big tech companies claim to protect user data, there's always the risk of it being sold or misused. For sexually transmitted infections, where privacy is even more critical, this can be a serious barrier to artificial intelligence adoption. In some countries, STIs are reportable diseases, which raises ethical questions about how artificial intelligence platforms handle user data and comply with regulations. All these challenges highlight the need for careful consideration and stricter guidelines as AI becomes more integrated into healthcare. Future directions and potential applications. As much as artificial intelligence is advancing, we're still not quite ready for AI to fully handle STI treatments. Right now, legal and regulatory issues are the biggest hurdles. However, the idea of automated treatment paths similar to existing syndromic management might not be too far off. Expanding direct-to-consumer D2C services to include treatment could really boost access, especially in underserved areas. But before AI-based treatments can roll out, we need solid testing to see if they can actually replace or just complement current methods. We also need to address the underrepresentation of women and LGBTQ+ individuals in AI models for STIs. This means ensuring diverse images and data are included to improve diagnosis and care for everyone. Language is another big issue. Most e-health resources are in English, which creates barriers in countries where it's not widely spoken. For artificial intelligence to be truly effective, it needs to support different languages, including vernaculars, with smart chatbots that understand cultural nuances. Conclusion. In conclusion, AI has the potential to transform how we handle sexually transmitted infections, genital diseases, and sexual health in general. But there's still resistance, mainly from traditional mindsets in healthcare. While caution is understandable and necessary for patient safety, it's important we don't let it hold back progress. For artificial intelligence to truly make a difference, we need more research, better regulations, and, most importantly, collaboration between policymakers, healthcare providers, and tech developers. We're just at the beginning of this journey, and it's exciting to see where it'll go next. Thanks for sticking around until the end. If you found this information helpful, don't forget to like, share, and subscribe for more insights on health and tech. See you in the next video.